What are you looking at when you come at me with that instrument, good man?
Well, there's a couple different ones. Basically, we're looking at the structures in the eye to make sure they're healthy. We look at the front surface of the eye to make sure the cornea is clear. We look inside of the eye to make sure the lens is clear. When the lens gets cloudy later in life, that's called the cataract. And then we look all the way to the back of the eye to the retina. That's the inside lining of the eye. And that's the, if you think of the eye like a camera, it's like the film in the camera, the retina is.
And of course, is one ever too old to receive an eye examination?
Oh no, not at all. Not at all. In fact, the older folks have a lot more health issues with the eye. Things like macular degeneration come into play, glaucoma, high blood pressure, diabetes, all of those things, and the cataracts like I talked about. They seem to be a lot more prevalent in the senior population. And so we want to make sure we monitor those periodically so that if we see any changes, we can act on them earlier rather than later. That's for sure.
Right, yep. Hey, we have a question from you, caller. What's your question, please?
Hi, I just have a couple of questions. How do you get a torn retina? And if you get one, what are the procedures to fix it?
How do you get a torn retina? There's a lot of different causes. Eye injuries are one of the big things that happen with a torn retina. Sometimes
like impact? I mean,
impact injury. Yeah. Yep. If you get hit in the eye, you know, a racquetball, a baseball, car accidents, things like that. You know, I've seen patients who have a torn retina from that. Repair-wise, depends on the surgeon, but most of the time it's some type of surgery. They can do a laser surgery repair where they tack the retina back down into place. Or they have a couple other things, but it depends on how severe or where it is. But the signs and symptoms of a tear, they can also happen spontaneously too. So some people who have high prescriptions are at risk because the retina is a little bit stretched in somebody who has a high prescription. Their eye is a little bit longer than average. So we keep extra close tabs on them, seeing them more often than you know, every few years or something like that. But signs and symptoms of a retinal detachment, if you have any floating spots in your vision or new ones that you haven't seen before. Also, if you see anything like a veil or a curtain coming down over your vision, that can signify that there's a problem going on. Those type of things, you want to get in and see your eye doctor that day. You don't want to wait until your next appointment or till your yearly exam. You want to get in and see them right away so they can rule that out.
Gotcha. All right. Thank you. Good luck to you, caller. Another question from you. What's your question, please? Hi.
Hi, doctor. Thank you for taking my call. I hope that this doesn't sound like too silly of a question, but a lot of television set manufacturers are coming out here. There's going to be a stream of them here in the summertime here with a 3D type format. And so I don't know if there's any been studies done here or yet too early here to make a determination, but when you have to wear these funky type glasses and goggles here to watch 3D on your television set, are there any potential adverse side effects here to that? And or is it also too because of maybe this is entry level 3D television set that things will not be perfected to the state where they really would need to be? I hope that this doesn't sound like too silly of a question, sir.
No, not at all. It's actually quite the buzz in our industry right now. Obviously, you know, we work with the eyes and vision and things like that. I haven't seen the 3D televisions yet, so you know, but I hear they're pretty good. Seen some of the 3D movies lately, which are excellent, I think. The interesting thing about 3D vision and the eyes is we need both eyes to see well and to team together to see in 3 dimensions. That's one of the other things, you know, when we talked earlier about children that we check so that kids have good depth perception. We need both eyes to see well. If we don't have good depth perception, those 3D TVs might not work real well for us, so that might be a reason to get into the eye doctor. There's some doctors who specialize in you know, going back and redeveloping that depth perception in the eyes. That's called vision therapy, where they actually work with that. There's developmental optometrists who work real well with that. I do a little bit of that in my practice for some of the cases of vision problems where the eyes aren't working perfectly together. But yeah, the 3D TVs, I hear they're pretty good, and I think it's adds a lot to you know, the viewing experience.
Wow. A year from now, we'll all have our 3D TVs. We're going to take a quick break, show you what's coming up next week. You're watching Ask the Optometrist. Stay tuned.
Hello, thank you for taking my call. On a lot of the home shopping things, they talk about you're able to buy readers. I wear bifocals. Now, are readers something that I would be able to get, you know, mostly to read outside without taking my bifocals, or do I have to have like a prescription for certain type of glasses?
Thank you.
Sure, that's a good question. Reading glasses, the over-the-counter readers or the non-prescription reading glasses work well for a lot of folks. However, some people who, it sounds like you wear a bifocal lens, meaning you need some correction for distance, and you also need some correction for the up-close tasks that you do. The reading glasses, the over-the-counter reading glasses, don't take into account the individualized nature of your prescription. So you can only focus one distance with those. Usually they set them for up close. So if you want to look far away, you have to take those off and put them back on to look up close. The other thing is the prescription between the eyes is not always equal. In fact, I bet 80–90% of the patients that I see, the prescription is not equal between the eyes. The over-the-counter readers, the manufacturers make them equal when they put them together to sell over-the-counter to folks. The other thing is the glasses that you would get from your doctor, we line up the optical center of the lens with the optical center of your eyes, which is different between each person. Optimally, the prescription lenses are optimized to your vision, your prescription, your body size, and all of that. So you're going to get better vision, you know, with a prescription pair. But some folks do just fine with the readers. You know, maybe their vision's not quite as sensitive to that. So
Good luck to you, caller. That's for sure. Computers, are they good or bad for our eyes?
They're good. We get a lot of strain at the computer distance. Just like some folks need some prescription for the up-close tasks, some others need for the computer distance. These days we're spending more and more hours at the computer. I know I spend several hours a day at the computer. And when we check prescriptions, normally we're checking for 20 feet away. You know, when we do the 20/20 test, we're looking 20 feet away. Computers, generally, we have a little bit closer than that, so our eyes actually have to focus a little bit to see clearly there. When we read, we bring it in even closer than that. Some folks who sit at the computer all day, their eyes are pretty strained. They get tired at the end of the day. They get headaches or maybe their neck aches from sitting at the computer. It's because they're straining to see clearly at that distance. We can do a vision test at that distance and correct for their vision and make a pair of glasses, contacts, something like that, that sets their vision at that distance. This would be a pair you would wear for computers and up close, not necessarily for walking around, but definitely can make things a little bit less stress or strained, you know, when you're at the computer screen throughout the day.
Yeah.